Hello, Jenny. How are you? Good, good, good. A quick lecture tonight, Jenny. The second half. Yeah, oh yeah. That's good. Getting prepared for tomorrow, right? Getting prepared for tomorrow. Mm-hmm. Well, hopefully this will help with some cardio. Hi, Shanette. How are you? We have comp comp B this week. That's good, Shanette. We got comp B this week, so hopefully the cardio will help a bit. All right. Mm-hmm. Hopefully it'll help a bit. All right. Not too long tonight, guys. Not too long. Just a couple. Yeah. But make sure, Jenny, that you're doing your 2019 test plan. Like reinforce everything. Like all of your studying should be geared toward that 2019 test plan, the NCSBN test plan. So you'll go through it and you'll just do, click, click, click. If you know it, then put a check mark. If you don't know it, put an X, because your comp is the 2019 test plan condensed. So that's all. You always want to use that as your guide. All right. You always want to use that as your guide. And keep in mind that you still have time. You guys still have time. Whatever happens this week, you still have time. All right. All right. So let's do it. Cardiovascular diagnostic tests and procedures. Okay. So we're going to talk a lot tonight about diagnostic procedures and, therapeutic procedures also. Okay. But I really want you guys to focus on the cardiac cath and the CABG. So I'm going to really elaborate on those, but I have other diagnostic procedures and therapeutic procedures that you'll see. But I really want you to focus on the cardiac cath tonight and the CABG. All right. So Holter monitor. Just imagine tonight we're talking about a patient. Remember, we talked about a cardiac workup. It was Friday. We talked about someone having a complete cardiac workup. So now the workup continues. Okay. Hello, Giovanna. Hello. So now the cardiac workup, it continues. Okay. So let's talk about the Holter monitor. The patient already had the labs drawn, all of those things that we discussed last night, the ECG. Well, I'm sorry, all the things that we discussed Friday. Remember last Friday we talked about lab values, we talked about the ECG. Well, tonight this patient is going to have a Holter monitor, echocardiography, and exercise test. The cardiac workup continues. Miss Amy, we're gonna do that Friday because that's kind of deep. That cardiac, the blocks are deep. So we're gonna do diagnostic tests and procedures because that's gonna be pretty deep. So I just wanted to do something light tonight. So we'll do that on Friday. All right. Yeah, it's deep. I mean, I've got some like different little rhymes and everything that you'll like, but I have to add some more normal rhythms in there so you'll truly understand it. All right. So this guy, he's getting more diagnostic tests. They're trying to figure out what's really going on cardiovascular wise with this patient. All right. So this patient will have a Holter monitor, can possibly go home with a Holter monitor. They'll do something like this to identify dysrhythmias. Okay. Just imagine a patient being in the hospital for 24 to 48 hours and there is no irregular dysrhythmias on the telemonitor. All right. So the patient can't stay in the hospital forever. So they're gonna have to take the patient home, send the patient home, and they'll send the patient home with a Holter monitor. This is usually a patient that was fainting. Someone had some type of episode that led them into the hospital. And then when they get in the hospital, they're on a telemetry monitor and the rhythms are regular. They can't determine what's going on with this patient. Why is this patient fainting? All right. So you guys know in the hospital, you have to go home. They're not going to let you stay there forever. 2-3 days tops. So this guy's been there 2-3 days tops and no one knows what's going on with the patient. So they'll send the patient home with a Holter monitor to kind of monitor them for, to see why is this patient fainting or why is this patient becoming symptomatic at certain times. So they'll send them home with a Holter monitor. It will identify dysrhythmias. They'll possibly do an echocardiography. And what this does, it evaluates the structural and functional changes in the heart. So this is a huge deal. And they may do an exercise stress test. Now, for this stress test, guys, as new nurses, I want you guys to remember that this patient, you want this patient to bring in running shoes. Tell the patient to tell the family, hey, can you bring him some running shoes because he's going to have this stress test tomorrow. Okay. And he's going to be on like a treadmill. So he needs to have some supportive rubber soled shoes. So that's a big deal for nurses, guys. So you have to know that. You have to let the family member know, hey, can you bring him some shoes in the morning? All right. So let's go. Remember these diagnostic procedures. This is for that patient, guys, that we're doing this full cardiac workup. All right. So Holter monitor, echocardiography, and exercise cardiography testing. So this is the Holter monitor. This patient will actually go home with this monitor. All right. Now I know it looks like a telepack, something that you see in the hospital. Well, this is an actual Holter monitor. And you see, I put a picture here. It says recording device because this is actually going to, right. Do not drink coffee or smoke. All right. Very good. This is actually going to monitor the patient's, rhythm. It's going to let you know, okay, at this certain time, this is what happened to your heart. It lets the cardiologist know. All right. It lets the cardiologist know it's a recording device and this patient will go home with it. All right. And then you want to tell them to not drink, don't smoke or drink because you know that these can cause irregular rhythms also. All right. It does. It's a stimulant. Coffee, the caffeine, smoking, it can cause some heart problems also. So you definitely want to tell a patient if they're experiencing any type of cardiovascular incidents, to kind of stay away from caffeine and smoking. They can, drink other things, but not those things that can have an effect on the heart. So you have the echocardiography. So just kind of take a look at it. Okay. It evaluates structural and functional changes in the heart. So the patient may go down for an echocardiography. All right. This is non-invasive. And you just basically want to tell your patient to kind of be prepared to the gel is cold, things like that. But it's at least it's not invasive at all. Okay. And of course, guys, they're going to do the stress test. So make sure that you tell your family members, tell the patient's family members, or to remind the patient that someone needs to bring them some support shoes, some rubber shoes, rubber sole shoes. So as you guys can see here, the patient will do some exercise and they're recording the patient. You see the electrocardiogram is there. Okay. So they're going to be able to determine what's going on with the patient's heart under certain stress. All right. So they'll do the stress test. All right. Now, one thing I want you guys to remember, please remember about the stress test. Make sure that your patient is aware that they have to bring the proper shoes. So this is the only one that I found with some shoes so you guys can kind of see. All right. Make sure that's a big deal. All right. So other other diagnostic procedures, it will be like the digital subtraction angiography. So the digital subtraction angiography, that's a big deal. So they're going to actually visualize the cardiovascular system. All right. One thing, guys, as a nurse, make sure that you assess as a nurse, as a first year nurse, a new nurse, you need to make sure that you're asking the patient about allergies to seafood, allergies to iodine, okay? Allergies to radiopaque dyes, because just think about it. Digital subtraction angiography. Okay, they're going to visualize the cardiovascular system using this contrast, using this dye. So as a nurse, guys, make sure, a first year nurse, that you're asking your patient, are you allergic to seafood? Are you allergic to iodine? Are you allergic to radiopaque dyes? Because this patient may not be a candidate for this procedure. And they'll also do myocardial nuclear perfusion imaging. All right. This is like a thallium imaging. So it can evaluate cardiac motion and calculate the ejection fraction, guys. Okay. Because that can give the patient a prognosis, especially it'll kind of let the doctor know and the family know the ejection fraction can be able to tell the prognosis of that patient, if it's a poor prognosis or if they have to do something else for that patient, especially if the ejection fraction is less than 40. So when you guys hear that, oh yeah, his ejection fraction was less than 40, they probably had a myocardial nuclear perfusion imaging. All right. And you have your MRI. Believe it or not, the MRI, non-invasive test, image of the heart or great vessels. So you guys know to always educate the patient. Maybe the patient may be claustrophobic, guys, but you definitely don't want to give them an anti-anxiety medication if they're trying to assess the cardiovascular system. All right. So just let the patient know about some patients do not like to have MRIs, guys. And remember that they're noisy. So just let the patient know, listen, MRIs are very noisy. All right. But you're going to have to double check about that anti-anxiety med. Okay. Because you don't want to do anything that can alter the heart. So this is digital subtraction angiography. So this is how it looks. Digital subtraction angiography. All right. So you can kind of see they visualize the heart. All right. They'll do that. So as a nurse, make sure that you're assessing the patient for any allergies, guys. Okay. Make sure that you're assessing your patient for any allergies because they may not be a candidate for this particular procedure. All right. And this image, you can kind of see it better. You can actually see the arteries. All right. Background, the dye in artery, no dye yet in myocardium. So you can actually see the arteries. So they can determine if there's some type of blockage or some type of stenosis or something is going on with the digital subtraction angiography. But as a nurse, just make sure that you guys are aware of the allergies, the risk. Okay. So, it's never, you can always ask. I always ask the patient, and I always look at the kidney function also whenever I'm giving when I know my patient are going down for any type of procedures that involves dye or contrast media. And look at the myocardial nuclear perfusion imaging. All right. Remember this said this can determine the ejection fraction. Okay. I do not know how, but I just wanted to give you guys an image of it because, you know, the radiologist would definitely have to read this. And just know that, you know, that thallium, they're using the thallium to with this particular patient. So just be aware of that. And this is what they're trying to determine. So I want you guys to definitely remember this. Now, this you have to remember. All right. Myocardial nuclear perfusion imaging, ejection fraction. So they're trying to determine the ejection fraction, guys. It's very important for the patient's prognosis. All right. So just remember the ejection fraction, guys. And usually less than 40 is an issue. That's what I read. All right. So just remember the ejection fraction. And of course, they'll do the MRI. The MRI. They can actually, you know, have an image of the heart for the great vessels of the heart with the MRI. All right. Tell your patient about being, you know, if your patient may be claustrophobic, give them a heads up. Remember, no metal. Okay. Pacemakers. Ask your patient about pacemakers, guys. And let them know that it makes a lot of noise, that the machine is very noisy. All right. All right. So these are even more cardiac tests and procedures, you know, even more diagnostic tests and procedures for the patient. So you have something called electrophysiological studies. EPS is what they call it. So this is EPS. All right. Invasive procedure in which programmed electrical stimulation of the heart is induced to cause dysrhythmia. So they're inducing a dysrhythmia because they want to see it for themselves. They want to see it in real time, and they'll record it, of course. All right. Assist in finding accurate diagnosis and determining treatment. So this is an invasive procedure in which programmed electrical stimulation of the heart is induced to cause dysrhythmia. So they're causing a dysrhythmia for this patient. And then you have electronic beam computed tomography scan. This determines whether calcifications are present in the arteries, which you guys know could be a huge deal for the cardiac output. All right. So electronic beam computed tomography scan. And our favorite, guys, our must know, our absolute must know, cardiac cath. Now, this, guys, you must know. All right. You have to know this front and back. Cardiac cath, you must know this. So tonight, before you go to bed, put on a YouTube video and look at the cardiac cath. Okay. Become one with the cardiac cath, because you will get some questions on this. Okay. So the cardiac cath, invasive test involving insertion of catheter into the heart and vessels, obtains information about the structure and performance of the heart chambers and valves and coronary circulation, guys. So look, it can tell you about the structure of the heart, performance of the heart chambers. It can tell you about the valves of the heart. It can tell you about the coronary circulation. So you're going to get a lot of patient, guys, that are going to go down for this. When I was working on the floor, now this is what I saw. I saw a lot of patients. I prepared a lot of patients for cardiac cath. Okay. Pre and post. Okay. So that's a biggie. Make sure you know cardiac cath front and back, everything about it. And we're going to talk about it even more. All right. So this is EPS. EPS. So remember, for the EPS, they're actually causing a dysrhythmia. So they're actually going to cause a dysrhythmia, guys. So this is EPS. And then you have your CT, electronic beam CT scan. So this is going to give you an idea. This is the best picture that I've found. So, you know, it's a CT scan, an electronic beam computed tomography, CT scan. So that gives you an idea what they'll be doing to kind of get a visual of the heart as well. All right, electronic beam computed tomography. And our favorite, our absolute favorite that we have to know as a first year nurse, we must know is our cardiac cath. So go ahead and take a look at the cardiac cath. This is a must know. Cardiac cath. All right. Guys, don't get confused if you see angiography, if you see a coronary angiogram. All right. This is an invasive diagnostic procedure used to elevate the presence and degree of coronary artery blockage, guys. All right. So I want you to kind of take a look at this patient here. Take a look at this visual. All right. The angiography involves the insertion of a catheter into the femoral vessel. So just find the femoral vessel and just imagine a catheter being inserted into the femoral vessel and threading it into the right or left side of the heart. And this, okay, I'm going to say that again. All right. Find the femoral artery. Okay. Angiography involves the insertion of a catheter into the femoral vessel and threading it into the right or left side of the heart. All right. So they can find coronary artery narrowings, occlusions are identified by the injection of contrast media under fluoroscopy. So they'll be able to determine, if there's any occlusions, if there's any narrowings, because the contrast media is going to show it all, is under fluoroscopy. Guys, so you're going to have to take care of this patient when you come back. When the patient comes back, guys, you're taking care of this patient. So I want you to remember that you need to check that site. All right. Make sure you check the site, guys, for bleeding, for hemorrhaging. So you have to check the femoral artery, guys. All right. You want to check the femoral artery for any type of hemorrhaging, and you want to make sure that the leg remains straight. This patient is going to be on bed rest for up to 4 to 8 hours, guys. So you see how he's laying now? That's how he's going to remain. Okay? The way that he's laying now is how he should remain. All right? And I'm checking that site as many times as I can because I'm afraid that he's going to start hemorrhaging. Okay, so just the way he's laying now, guys, that's how I'm going to keep him. And all of the pulses that's distal to the insertion site, I need to make sure I'm checking. All right, I'm checking those pulses. So cardiac cath again. This is cardiac cath again. All right. Angiography. It involves the insertion of a catheter into the femoral vessel, okay, and threading it into the right or left side of the heart. Okay, so this can determine if there's any narrowings, any occlusions, and they do it under fluoroscopy. All right. So when that patient, you see how that patient is laying flat now, that's how I'm going to keep him. All right. They say, some books say 4 to 6, some books say 4 to 8. Yours says 4 to 6. Your HCI, it says 4 to 6. I'm sure. I'm positive, actually. All right. Your book, just keep that in mind. All right. So you want to make sure that he is flat, guys, and you're checking that site. Look at the femoral artery. Okay. Just envision where they went in. All right. Just envision the dye. When they pull out the catheter, guys, when they pull out that sheath, make sure that you're checking the area for hematomas, for hemorrhaging. And you see that popliteal pulse? You always want to check the pulses distal to the insertion site. Always check the pulses distal to the insertion site. That's your job. That's what you are there to do. You make sure that he's flat and that you're checking for hemorrhaging. That's your job. That's what you're going to get paid the big bucks to do. Okay? So don't forget that. That's what they have you there for. That's a big deal with cardiac cath, guys. All right? So let's go over it. Let's discuss it. It can be coronary angiogram, also called cardiac cath. All right? An invasive diagnostic procedure used to evaluate the presence and degree of coronary artery blockage. They need to know what's going on, and they're going to use that dye under fluoro to determine if there's any type of occlusion or blockage. So angiography involves the insertion of a catheter into the femoral vessel and threading it into the right or left side of the heart. All right? So this is an invasive procedure. So as a nurse, you don't take this lightly. A first-year nurse, you're very, very aware of what just happened to this patient. So you need to make sure you keep this patient safe. All right? So it's going to determine this procedure, the focus of this procedure, the reason, the rationale for this procedure, guys. Coronary artery narrowing and occlusions are identified by the injection of contrast media under fluoroscopy. So this patient had some type of event, guys, some type of cardiovascular event. Maybe he was suffering from chest pains, or maybe he has maybe he had an MI, suffered an MI, and now they're gonna go deeper. They're gonna do a diagnostic procedure to be able to determine what's really going on with this patient. Okay. So they're tracking the coronary arteries for narrowing in occlusions, because this is probably why the patient is having the MI. This is the reason why the patient is having the chest pain. All right. Now, as a nurse, you need to be able to take care of this patient before, if you're there intra, and then post. That's our job. All right. So first year nurses, you get this patient all the time. So you have to know this. All right. So what are some of our interventions? Make sure that the patient gets his consent. Sign the consent forms are signed, guys. All right. As a nurse, don't witness informed consent if the patient doesn't understand what's going on. All right. The patient has to be NPO 8 hours prior to. And a big thing is, guys, assess for iodine, shellfish allergies. Okay. Because remember, this patient is going to have that contrast media. All right. Remember that. So you need to make sure that you're assessing for any of those allergies. All right. That's a huge deal. Okay. So let's go back to pre-care real quick. Cardiac cath, because remember, this is a huge deal. So as a nurse, we're really thinking about this. Pre-care, the patient history and physical will match up. So if I have a patient who has chest pain or MI, his lab work, elevated troponins, elevated acute cardiac profile, then a cardiac cath. I can see why a doctor would schedule you for a cardiac cath. All right. The history of physical aligns with the diagnostic procedure. All right. Lab work. I'm looking at the lab work. I'm looking at the EKG. I'm looking at the results of the echocardiogram. I'm looking at the CBC. Maybe the WBC has increased. All right. The patient is NPO. And then I'll go ahead and start teaching my patient and letting my patient know, listen, you're not going to be able to move for 4 to 6 hours after this procedure. Okay. Oh, I'll let my patient know, listen, when you come back, I'm going to be looking at the site often. Okay. So if you fall asleep, I'm sorry, because I'm going to look at that site often because I'm afraid that you might start hemorrhaging. Okay. So post-care, I'm going to monitor the vitals, guys. You know, this is what we do. We monitor vital signs. And the big thing I want you guys to remember is, even if my patient is sleeping, guys, I'm going to monitor the extremity distal to the catheter insertion. Even if he's asleep. I'm going to go in and I'm going to check the popliteal pulse. I'm going to check the pedal pulse, even if he's asleep. All right. Vital signs. And I'm checking for bleeding at the insertion site. And I'm measuring eye and nose, because remember, this guy had this contrast media, and I want to check the kidney function. I want to see if he's doing okay. I want to make sure there's no type of internal bleeding. And I know that 30 mLs an hour, that's a good indication that everything is perfusing the way that it should. So this is a big deal. The cardiac cath is something that's done quite often, but as nurses, guys, we still have to be very, very vigilant. I know they bring the patient up to us and they just drop the patient off, but guys, you have to make sure that you are looking at this patient, that you are checking on your patient. Because this is what just happened to that patient. Just imagine that going into your femoral artery to your heart. All right, so just look at the there's a wire there, a guide wire, and look at the catheter. Look how long. So I want you guys to make sure that you are vigilant, guys, that you are taking care of the patient pre-operatively and post-operatively, because look what just happened to the patient. So we're very, very afraid of hemorrhaging or hematomas. Okay. So I have to just let you guys know, sometimes they may go through the brachial artery, guys, and I want you to remember that they can go the radial artery also. So they can go the brachial and the radial. Just remember that you are very, very aware that this patient may have may hemorrhage or develop a hematoma. So you are still assessing the patient. You are still monitoring the sites, the pulses distal to the site. All right. So you have to actually document that. So remember the brachial artery and the radial artery. The brachial artery and the radial artery. Okay. The doctor can use those sites as well. All right. It just depends. All right. So look at this. This is what I'm afraid of, guys. This is what I'm afraid of when I go into the room. Whether it's a brachial artery or a radial artery or a femoral artery, I'm afraid of these things happening. Hematoma. All right. A pseudoaneurysm, or any type of arteriovenous fistula. So when I go into the patient's room, I'm constantly looking at the site. Okay, because I need to call a code right away. I need to let the physician know right away. All right, so guys, a few more things about cardiac cath. I want you to just hear me out, okay? After, post procedure of the cardiac cath, all right, always assess for bleeding, hematoma formation. Make sure you have the patient lie in the bed for 4 to 6 hours, guys, after the procedure. All right. The patient may have to go on some type of antiplatelets. So I want you to be very aware of that. Antiplatelets, guys. All right. Be very aware of that. And always, always, always check the urinary output. It gives you a good indication that everything is perfusing properly. All right. So I want you guys to make sure you keep that in mind. All right, real quick now, let's do a couple of therapeutic procedures, something that's going to actually make the patient feel better. Once they've diagnosed the patient, now they're going to do some things to provide some relief for this patient. Therapeutic procedures now, something therapeutic. So the first procedure we're going to discuss is percutaneous transluminal coronary angioplasty. Angioplasty. So believe it or not, guys, as a nurse, when you see your patients with these procedures, these angioplasties, the first thing you want to do is talk to them about lifestyle changes, lifestyle modifications, guys, because what's the point of going in and breaking up all this plaque and then the patient goes home and resumes their regular life? The fast food, the foods high in cholesterol, the sedentary lifestyle, that's what got the patient here. This is why the patient has to have this percutaneous transluminal coronary angioplasty lifestyle. Okay. So as a nurse, what you want to do is make sure that you're educating your patient on healthy lifestyle, low sodium diet, low fat diet. Okay. You want them to commit to change. All right. They have to change. So this patient has to be NPO after midnight. And after they have the procedure, of course, you want to maintain bed rest with limbs straight for 6 to 8 hours. Very familiar. All right. Similar to the cardiac cath. After the procedure, you want to check for bleeding. After the procedures, you want to check vital signs, if there's any change in vital signs. All right. So that's the percutaneous transluminal coronary angioplasty. NPO, extremity needs to be, straight for 6 to 8 hours. And you are checking those pulses. All right. The distal pulses. Laser assisted angioplasty is just what? Lasers. They're using lasers now to break up the plaque. All right. Same treatment, guys. When the patient comes back, make sure that assess for bleeding, assess for changes in vital signs. And then if the patient has to have coronary artery stents, okay, this is going to be a bit more involved because we're afraid of thrombosis. So this patient is going to go on antiplatelet therapy for several months following the procedure. So make sure that the patient is well aware of that. They have to go on antiplatelets because this patient may very well start throwing clots after this procedure. Okay, this patient may start throwing clots because they actually left something in the body. And you know how the body reacts when you leave foreign things in the body. So this patient may start having plaques. I'm throwing clots. All right, so this is the percutaneous transluminal coronary angioplasty. All right, percutaneous transluminal coronary angioplasty. Look at, they're actually going in to break things up. All right, so remember that. All right, remember how you have to take care of the patient when the patient comes back. And this is just laser. This is the best one I can find for laser angioplasty. They're going to go in and they're going to actually use a laser to break up the plaque. Remember, you want to take care of the patient when the patient comes back. You're checking those pulses. You're checking for hemorrhaging. And then you have your coronary artery stents. Now, remember, whenever there's anything foreign in the body, guys, we're afraid that this patient will start to throw clots. We're afraid of thrombosis. So we have to make sure that this patient is on antiplatelet medication. So that means that he's also going to be a bleeding precaution. So educate your patient because this patient now may have stents. This patient has stents. All right. So our biggest concern is thrombosis. All right. Here are a few more therapeutic procedures for someone who has coronary artery disease. All right, so this is arthrectomy. This is basically, they're going to go in and they're going to remove some of the plaque whenever you see ectomy, removal. And then you have the transmyocardial revascularization. All right, this uses high-powered lasers through small chest incisions in the chest with widespread atherosclerosis. So this patient has coronary artery disease. He's full of plaque. And then you have your peripheral arterial revascularization. So this is also what they'll try to actually, they'll bypass the artery or they'll go in and they'll kind of clean out the artery. All right. So let's just take a look. So this is transmyocardial laser revascularization. So these are the laser channels in the left ventricle. So they're actually going in to, get the blood flowing. Again, transmyocardial laser. And then this is arthrectomy. They're going to go in. They'll do different things to remove the plaque. You can see they use different ways. This one says transluminal. They'll do rotational, they'll do directional, but whatever they do, they're actually going in to remove that plaque. And the big one, the huge deal, in my opinion, is the peripheral arterial revascularization. All right. So you guys know if there's not enough blood flow, if there isn't adequate blood flow, then it can lead to amputation. So what they'll try to do is they'll try to revascularize the artery, to prevent any type of amputation. All right. So that's the revascularization. And the biggie now. Therapeutic procedure that you guys must know. The biggie, the cabbage. All right. This is the coronary artery bypass graft. And guys, they want a first-year nurse to be able to take care of this patient. So you have got to know coronary artery bypass grafting. You must know this because they expect a first-year nurse to be able to take care of this patient. Okay? So this is a huge deal for us. So let's take a look at it. Coronary artery bypass. So what did they do? Coronary artery bypass graft. Look what they did, guys. All right. This is performed to bypass an obstruction in one or more of the coronary arteries. All right. This procedure is most effective when a client has sufficient ventricular function. So the patient has to have an ejection fraction greater than 50, guys. All right. And you guys see here, single, double, triple, quadruple. All right. Is performed to bypass an obstruction in one or more of the coronary arteries. Cabbage does not alter the plaque process, but improves the quality of life for clients restricted by painful coronary artery disease. Just look, single, double, triple, quadruple. Okay. This procedure is most effective when a client has sufficient ventricular function, ejection fraction greater than 50. Okay. So that's the coronary artery bypass. All right. It is an invasive surgical procedure that aims to restore vascularization of the myocardium. Look at that myocardium, guys. Look at it. It looks like it needs some type of revascularization because this patient is having painful chest pain. Okay. So they want the patient to at least have an ejection fraction greater than 50. All right. So as a nurse, what can I do for this patient? What is my job? What is my job before this patient goes down for this procedure? Well, guys, make sure the coronary artery bypass graft, there's an informed consent. Make sure that you have a baseline assessment because our older clients may experience transient neurological changes. All right. So make sure you have a baseline assessment, guys. And make sure that you're administering the medications prescribed by the physician when you're supposed to administer them. That's a huge deal. Medication compliance. And real quick, guys, for this one, for the baseline assessment, you as a nurse want to know there's a baseline assessment of cognitive status, guys. Make sure that you know any health issues, like if the patient is diabetic, if the patient has any hypertension, if the patient has had a stroke. So you need to know that. And most importantly, guys, make sure that you know the support system. So the baseline assessment, guys, this is a very, very intense assessment. Make sure you know the neurological status of this patient. If this patient has hypertension, if this patient has diabetes mellitus, guys, and you need to get a phone number for a family member. You need to know the support system. Okay. Now, medications, guys. All right. It just basically depends on the physician. The physician will order the medication. Just make sure that you are educating the patient about these medications. It may be anxiolytics, guys. It may be some type of anticholinergic. It may be some type of antibiotics. So don't be alarmed if the doctor has ordered an antibiotic 30 minutes before the procedure. So you have to make sure that you administer those medications exactly how the physician says it. All right. Because if it's an antibiotic, if he wants it 30 minutes prior, please give it 30 minutes prior. He's going to be very upset if you don't. Okay. So make sure informed consent, baseline assessment, guys. Know the neurological status, know any health issues, diabetes, hypertension, and administer the meds as the physician orders them. If he orders antibiotics 30 minutes before the procedures, 30 minutes before the procedure, you start the antibiotic. Make sure that before the patient goes down to the procedure, you teach him about coughing and deep breathing. You teach him about arm exercises. You teach him about leg exercises because you don't want him to start developing DVTs. All right. So before the patient goes down, you can start teaching the patient and the family, the support system, about coughing and deep breathing. You can teach them about the proper arm exercises and the leg exercises to get that patient moving, because you guys know how we want our patients' blood to flow. We don't want any DVTs or anything like that. All right. We always encourage our patients to move. All right. Yes. Plavix. That's right, Ms. Giovanna. Plavix. The patient will have some Plavix. They're going to have some antiplatelets. All right. Yes. Now, post-operatively, maybe the patient will have post-operatively, you can expect. Don't be alarmed if your patient comes back with an endotracheal ventilation. Don't be alarmed if your patient has mechanical ventilation. You guys know how to suction. You know how to take care of a patient on a vent. All right. Endotracheal tube and mechanical ventilator for airway management for several hours following the surgery. You guys know when to suction. You guys know you're supposed to hyperoxygenate. You know that you're supposed to assess the lung sounds. So don't let it scare you. And you guys know the low pressure alarm sounds and the high pressure alarm sounds. Okay. Your patient will have an incision, guys. So whenever there's an incision, you are looking for infection. All right. We encourage early ambulation. And guys, you have got to take care of those chest tubes. So this can segue into a chest tube question. So you need to know those chambers of the chest tube. All right. This patient may have a urinary catheter. You guys know 30 mLs per hour. The patient may have pacemaker wires. Don't dislodge them. Okay. So all of these things, guys, endotracheal ventilation, mechanical ventilation, you know how to take care of your patient. Sternal incisions, infection. You're worried about infection. Early ambulation, because we don't want DVTs, and chest tube. You have to know the 3 different chambers. And you guys are going to anticipate the patient have a pulmonary artery catheter, arterial lines, infection control. All right. Infection. Okay. Post-procedure, guys, big deal. This is a huge deal. So you have to know this post-procedure, because they expect a first-year nurse to be able to take care of a patient who had this procedure done. So post-procedure, guys, you guys know airway. Dangle the legs. Always monitor hemodynamic pressure. Monitor catheter placement, guys. Monitor your neurological assessment and chest tube placement. Now is the time, guys, to make sure that you look at a video chest tube placement. Okay, chest tube placement. And the patient may, if very lucky, the patient may have a heart transplant for therapeutic procedure. All right. The patient may have a heart transplant. And one thing I want you guys to remember about a transplant is the medications. All right. Make sure the patient is aware that they will be on these medications for the rest of their lives. Okay. So you always want to just make sure that the patient is aware of that. When it comes to these transplant meds, guys, remember this will be lifelong to prevent any type of graft rejection. All right, because I don't know if he's gonna get another heart from anyone else, you know. All right, guys, that is it for therapeutic. And Friday we will have those blocks, heart blocks, Miss Amy. All right. So Friday, guys, will be our blocks. All right. And good luck, guys, with everything. Good luck this week. Make sure you're using your NCSBN as your guide for your comp B. So use that thing. It should be, you should have looked at it 1,000 times by now. All right. All right, guys. Good night. And I'll see you guys see you guys tomorrow. See you guys tomorrow night. All right. All right, guys. Good night. Thank you for coming, guys. Thank you so much.